So much. Whoops. Thank you for taking the next 60 to 75 minutes out of your Tuesday evening. We really do appreciate you being here, and we appreciate all the questions that you submitted and all of your feedback. It really does help us as we move forward with our plan. We have a jam-packed schedule. And so what I'd like to do is we're going to get to introductions. We're going to get to the flow of the evening through our first few slides. But Mrs. Land, if you could just put up that first slide, that'd be great. Thank you. So again, thank you for coming today. Over the last 72 hours, we have had over 2,500, actually it's closer to 3,000 questions have been submitted. And so we used your questions and we coded them and we put them into 3 themes. And the 3 themes are testing and tracing, cleaning, masking, and distancing, and then instructional models. And we're actually going to start with instructional models in a couple minutes. That's like the hybrid model, the remote model, and so on. So your questions and your feedback are so important because it really does shape our emergency response team and our agenda. Our emergency response team meets weekly, and we've been meeting since the pandemic started. And that sort of drives our agenda and also shapes our plan, shapes our operations as well. So again, we really do thank you for questions and feedback. So the one caveat tonight is the fact that we get updates from the Departments of Health, from Dr. Mendoza, as well as from the State Department of Health, as well as from Governor Cuomo on a daily basis. So the answers that I'll give to you tonight are based on the guidance that we currently have, but just know that I might come out in a week or 2 weeks and say, hey, you know what, I know I said this, but now this is the answer because it's based on new guidance. And there are going to be times I'm just going to tell you, I don't know. We're still working on it. So the meeting guidelines, by the way, this is the last of the parent meetings. We've had 5 already. You guys are our 6th group, and close to 1,200, at least 1,200 parents have signed up. So we're really pleased again with the turnout. So there are 5 guidelines for tonight. We are recording this last session. The other 5 sessions I think are up on our site. I know the first 4 are. I'm not sure if the one from this afternoon is already up there. And this has been helpful because a lot of people may not have, our times may not have been convenient, or you yourself may say, you know what did Mr. Gamina say on testing and tracing? I'm going to go back and watch our session. So again, this is going to last between 60 and 75 minutes. And we're going to use the slides that we made to really, because our slides are really designed by your questions. So what we found is going through these slides really answers many, many of your questions. We're going to use something called the raise hand feature. So at the bottom of your screen, you're going to see a tab called participants. And if you click on that when the time is right, and you raise your hand, it'll say raise hand. That's how you can ask questions during our question session, right? So we're going to divide the evening up into 3 different themes, okay? Tracing and testing, instructional models, and cleaning, masking, and distancing. After each theme, which takes about 20 minutes or so, we're going to open it up to you, and we can answer 5 to 8 questions, and then we'll move forward. So don't worry if you don't get your question answered tonight, because we're going to give you a feedback form right after this is done, and you can write your question there, and we'll get back to you either through the FAQ or through a personal email, or you can write to me. You can actually just send me a personal email, and I will get back to you within 24 hours. So I think most of us have been on Zoom or Google Meet for the last 6 months. So please stay on mute because the background noise can be really distracting. And the last bullet is the most important one. We are all sort of in this together, right? We have probably all been riding this roller coaster of emotions and feeling stressed, fatigued, frustrated, anxious, maybe excited that school's about to start. But we all are doing our best. So whether it's as a parent, as a student, as a teacher, as a superintendent, we're all just giving our best. even though some of my answers may not be what you want to hear, or some of the opinions or questions from others may not be the questions that you'd like to ask, just realize we're all doing our best and that kindness goes a very long way. So with that said, let's jump into our, okay. First, let's introduce the players. I always want to jump the gun, Mrs. Land. So I'm Carmen, I'm the superintendent. Brian Neenan is on this meeting. He's our deputy superintendent. From operations, we have Brian Freeman. He's our CFO, our chief financial officer. Blaine Cunningham is here. He is our expert on everything to do with buildings and grounds, ventilation, cleaning solutions, you name it, he's got the answer. From instruction and student services, we have Mrs. Land. She's actually moderating tonight. She's running the board, but she is our director of elementary ed. Colleen Armstrong is here, and she's our expert on student services, special ed, IEPs, 504s. From human resources, Dave Swinson is here. So in case anyone is inspired to join our district, become a teacher, a TA, or a bus driver, he's the man to talk to. From building administration, we have Mrs. Abley, principal at State Road, Mrs. Leggett, principal at Schlegel Road. Jim Bear is here from Spry, and Paul Benz is the high school principal at Trader. And then lastly, for all questions having to do with instructional technology and Chromebooks and Wi-Fi, it's Mr. Zimmer and Mr. Montemero, and they're on this meeting as well. So 3 themes: testing, tracing, cleaning, masking, and distancing, instructional models. We're going to start with instructional models. So let's first delve into the remote learning option. 100% remote. So think of, if you choose this option, your child is going to remote school. They have their own school, their own faculty. They have their own devices, which they'll get from us with a power cord. Their daily attendance is definitely required. They are in school. They're just not in one of our buildings. So, but there will be grades, there will be assignments, and attendance is definitely required. IEPs, 504s, those services, they're definitely provided as well. Mrs. Armstrong will talk just in a minute about those. And we're asking that families are going to opt into this choice for 1 semester at a time. So from now through the end of January. Why do we do that? It is because we are going to staff the remote option as soon as we know how many students, and we're expecting about 12% of our students will opt into this, according to the survey that 7,000 of you have now filled out. And we're going to staff, once we know remote, we're also going to know the in-person number of students, and we can staff to those in-person students, and we can make sure that we have the staff so that we can maintain our 6-foot requirement for the hybrid model. If we have students coming in from remote and sort of delving into the in-person model, we may not be able to staff it so that we'd be able to maintain that 6 feet distance. It is much easier to go the other way. You can switch from in-person to remote. It is definitely easier. We can definitely accommodate that. If your child has a whole bunch of services, it might take us a little bit longer to jigsaw puzzle or to jigsaw all those services together in the remote option, but it's definitely more doable. That's why, again, you're opting in for an entire semester. So before I move to the next slide, Mrs. Armstrong, can you just talk to us a little bit about that third bullet about IEPs and services?
Sure, thanks, Carm. Yeah, we did have many questions about what it will look like for a student who has an IEP in the remote model, as well as many questions about evaluations. So first I'll talk about the remote model. It will look different than what your child had previously in the spring when we were in our emergency learning. They will have a schedule, you'll have assigned teachers and therapists, and you will be provided those accommodations and services that are on the IEP. As far as evaluations go, we are starting to do our evaluations in person again. So your building team will be working with you on making sure that you're in that queue and getting those evaluations completed as well. Because these programs are individualized, we're happy to follow up with you from our student services office or from your building contacts to answer any questions that you have in regards to specifics for your student.
Thank you, Colleen. So let's look at what the remote option will look like at the elementary level. So at the elementary level, there will be, and this is very similar to the in-person model as well, because we're going to have two cohorts. We're going to have an AM session, and kids will be there, or kids will be assigned to the PM session. And every day for 2 hours, either AM or PM, they're going to be Google Meeting, because that's the platform we're going to use. We're not going to use Zoom. Zoom doesn't work well with Chromebooks. So we're going to be, the teacher will be virtually meeting with those students for 2 hours in the morning or in the afternoon. And during those 2 hours, they'll go through 3 learning blocks, one for ELA, one for math, and one for social emotional learning. The social emotional learning piece, that's like morning meeting. That's learning basically how to get along with others, really making those connections, talking about our essential skills like resilience or perseverance, communication, collaboration. It's just as important as ELA and math. So those are the 3 blocks. So before I go further, why is it 2 hours? Okay, that's not a half a day. I agree, it's not a half a day. Our half day is usually 2.5 hours. And I know what you're thinking, well, that's still not a half day, but that's our half day. That's how the state declares a half a day. And it's always been 2.5 hours has been our Webster tradition. And actually it's a Monroe County tradition going way, way back, even while I was a kid. So, but why is it only 2? Why isn't it 2.5? It's because we expect nearly half of you, again, according to the survey, are going to be driving your kids to and from school, which is fantastic because it lowers the number of kids on the bus. However, we also know that we're going to have to extend our time in the morning for arrival and at the end of the day for dismissal. So we've built in that extra half hour for arrival and dismissal, and everyone will be using an app that we have. It's called Pick My Kids, and we do think that after a few weeks, when everything becomes a little bit more efficient, that 2 hours might extend to 2:10 or 2:20. We probably won't get to 2:30, but we'll try. But again, that's one of the reasons why right now we're going to start at 2 hours. So on the opposite block, so if your child's in the AM remote, what are they doing when they come home? Most of it will be asynchronous, on-demand learning. So there will be modules or activities or programs that they'll be able to have access to. They'll be able to download art and music lessons that sometimes they might be live, but most likely they'll be on demand. And those will be right from our teachers that will put those together. They'll be able to access math software, reading activities, typing, maybe some assignments from the teacher. So we wanted to design a program that was a blend of live and independent, and also worked in some breaks and also lunchtime as well. But why go every day? Right? So and I think we're probably the only district doing this, but why are we every single day for 2 hours instead of just 2 days of the week, just all day? It's because the most important thing that we heard from teachers was that they wanted consistent daily contact with their students because they know how important a schedule and a routine is for them. So 2 hours every day they felt was much more valuable than all day on Monday, Thursday. That's why we designed it that way. Now at the secondary level, it's going to look much different. The secondary level, we're going to be following an odd even day format. So the periods will be 40 to 44 minutes long, right? And every single one of our middle school and our high school kids, every single one of them will receive an 8-period schedule. And it's a traditional 8-period schedule like most of us followed when we were in high school. Okay. So in that 8-period schedule, if I'm on remote, on the odd calendar days, like September 13th, September 21st, September 23rd, you get the idea. I will Zoom in live with my odd period teachers, 1, 3, 5, 7. My even periods, I'll be able to check in with those teachers It won't be mandatory. The 1, 3, 5, 7 will be mandatory on odd days. My 2, 4, 6, 8, I check in case I have a question, in case I need some extra help. The teacher may almost require me to come in, maybe to finish a lab or to finish a writing assignment, right? So, and then everything is flipped on the even days. So on October 12th, on October 16th, whatever, I'm meeting with my 2, 4, 6, 8 even period teachers. And I'm just checking in with my odd block teachers. So every day, a student is going to have a blend of live classes, independent work, on their schedule, their 8-period schedule. Lunch is built right in. Everyone has a lunch period. So they'll have a chance for a break as well. And many of them may have a study hall as well. We did it this way because we wanted to prevent that screen fatigue. We didn't want our kids on for 6.5 hours straight. So that's the 100% remote for secondary. Now, what does in-person look like? So let's shift now from 100% remote to the hybrid model, to the in-person model. Elementary, it's the same type of grouping, AM, PM, 2 hours with the same 3 blocks, ELA, math, and social emotional learning. And remember that 2-hour block of time, the 2-hour block of time can be extended. I'm sorry, if I said that for the remote, most likely it'll be between 2 hours and it might be 2:15, depending on what's going on. But it's really the in-person piece. So it's 2 hours to start with. We expect a whole bunch of you to be driving your kids back and forth. So when the arrival and dismissal gets shrunken a little bit, after a few weeks, we might be able to extend that 2 hours a bit. So AM, PM for 2 hours. The opposite block will be, again, that asynchronous, that on-demand piece. Now, what is a little bit different than the 100% remote for elementary is that art and music, those 2 specials, will be virtual this year, right? So for in-person learning, they're going to receive sort of like live classes virtually from the art teacher and the music teacher. And don't worry, if your child, for whatever reason, can't make that live class, we'll be recording those and you can just pull them down from the cloud when it's convenient for you. And again, they'll be able to also pull down from the cloud the typing, the reading, the math, and again, any assignments from the teacher. So we're going to have a blend of in-person, asynchronous on demand, and then there's lunch and breaks as well. Now, the hybrid learning for secondary looks a little bit different. For this one, our 6-12 students are going to school on either Monday, Thursday, or Tuesday, Friday, and they'll be there all day. And they'll run through their entire 8-period schedule. And on Wednesdays, they also run through their 8-period schedule, but it's remote and the periods are shortened. They're 25 minutes instead of being 40 or 43 or something, right? So there are 3 days of the week that they're having direct interaction with their teacher. Okay, 2 of those days it's in person, and 1 of the days it's remote. So why did we choose the Monday, Thursday split and the Tuesday, Friday? It's because we didn't want more than 48 to 72 hours to go by without a student interacting directly with their teacher. And so we thought that level of engagement was really, really important. So again, they follow their entire 8-period schedule, whether they're in person or whether even on the Wednesday day, but the Wednesday remote day, it's their mini classes. On the 2 days that they're totally remote, there's still learning that's going on. They are doing their homework assignments, any type of asynchronous activities that the teachers are planning for and putting up into the cloud. They might be working on a reading assignment, a writing assignment, and again, there's the asynchronous pieces that the teachers are working within their teams to also develop. Now, what does the schedule actually look like? The next slide shows you the actual schedule. So on the left is the in-person schedule for high school and middle school. So you can see they both start at 8:45 and they end at 3:15. And the classes are about 40 to 44 minutes long. And then For Wednesday, you can see the mini class schedule starts at 11 and ends at 2:55. All right, so I've talked long enough. That is the end of theme number 1. So now, if you have a question, you're going to go down to the bottom of your screen to participants and hit raise your hand. And then we'll start calling on you randomly, and we'll try to get through as many questions as we can over the next 8 to 10 minutes.
The first question comes from Julie Farr.
Hi, Julie.
Good evening, Mr. Gamina. I had a quick question about all virtual, entirely virtual elementary students.
Sure.
It sounds like they will have the opportunity to do specials. So it's kind of a 3-part question. Mine is a 5th grader. Will she also have the opportunity to continue with chorus and band virtually? And if so, is it possible that she might have her home school teacher instead of a virtual special teacher be teaching those classes? We love Mrs. B, so we're hoping we can get together.
I get you. So Julie, yes, our plan is to offer band, orchestra, chorus to remote and also to the in-person. We're still working out the kinks for that one. But we do plan on having that happen. I can't 100% promise you that it will happen, but right now we're moving forward with that. I definitely can't promise you her homeschool teacher for band or orchestra, but to tell you the truth, I don't see why not, but I don't see why I can't guarantee it.
And I was wanting for specials too.
Yes, so for specials, in terms of art and music and PE, no, I definitely can't promise you they're homeschool teachers for that one. Yeah, sorry about that. But
that's okay.
I'm going to get it done by elementary teachers, though. It'll be elementary specials teachers that are definitely doing it.
Okay, great. Thank you so much.
Thank you.
Next question is from Teresa Clemens.
Hi, Teresa.
Hi, Mr. Gamina. And I apologize if this question is going to be answered later on, but my question's about if our children are in the hybrid learning option and we have to shut down and go 100% remote, not by choice, but I presume that it'll go a lot smoother than obviously it did in the spring because we're planning for it ahead of time. Yes. Will the students be in their students be in their same class groups at that point? So I assume it'll be pretty seamless in that.
Correct.
Okay.
Yep, you got it. Yep, they just go virtual with their teacher that they have in person. And
then they'll just immediately follow that 100% remote that the other students have been following, essentially?
Yes.
Okay.
Yes. At elementary, right. Yes. Yep.
Okay.
Again, that's assuming that we shut down for a pretty big period of time. Yes.
Right. Yeah. Okay. Thank you.
Got it. Thank you. Next
question is screen name Galaxy J2.
Okay. Welcome, Galaxy.
Yes, hello.
Hi.
My question is, I was informed today that any students that are opting into the remote learning, that they're not, I don't know if I'm going to say this right, they're not really going to have an AM or PM schedule. Virtual is going to have their own kind of a schedule. They're not going to work with the same times as the schools are starting class.
Huh.
Is that true?
Well, that's news to me. So
okay, I was just wondering how that was going to work if they were going to have different times.
No,
I'm like, that doesn't make no sense.
we're going to keep the same schedule. It might be so, but
the things you hear.
But it's not going to. I bet you read that on Facebook. But yeah.
No, I didn't.
So nope, it'll be within 5 minutes of each other, 5-10 minutes. But we should all be set. Yeah, that's the only way we could do that. Tell you the truth. So. Yep.
Okay, good. Thank you.
Great question, though. Thank you.
Next question is Sue Mangiovi.
Hi, Sue.
Can you hear me?
Yes.
Hi, thank you for everything you're doing. I can't even imagine what this has been like. But thank you. My question is, so I'm a mom of going to be 2nd grade and 5th grade, and we're doing remote completely. And I'm just wondering we have AM, and I don't know if this was answered, but I'm helping both of them. So I don't know how am I supposed to, if it's exactly the same exact time, like in the spring, they were different times and it was all, online. So I could just help each of them when I could. Now it sounds like it's going to be the exact 2-hour time frame. How am I going to do that? How do I do that?
Oh, come on, Sue. It's easy.
I don't know how to bounce back and forth between the two, or do I just let them be? Should I just let them be? Like, what do I do?
You have two choices. You can either try to split your time an hour, right?
Okay.
And we don't really know the remote students. We really have to sort of resort into AM and PM. No matter what, last week that was really for in-person, and the remote we had to wait to see what our full load was, and then we can sort of resort. And Aaron, actually, you're the first person to ask this question, and you're not alone, because it's like, oh wait, a whole bunch of elementary parents have 2 kids.
Yeah.
More than 1 kid. It's like, yeah, I never really thought about that. So
my 5th grader can kind of handle it, but I also what if she has, am I supposed to help her or just let her be for those 2 hours? I don't know. Yeah.
So my gut would say, you know what, you're going to let them be, because they're in school, they're in class. And if they have a issue, maybe you help them. But for the most part, I would sort of say, yeah, let them be.
Okay.
So just think about that Beatles song.
Yeah.
Lennon,
so just kind of be around, but I'm not there. Okay.
That's right. Okay. Thanks, Sue. Okay.
Thank you.
You bet.
Next question is from Alyssa Eberts.
Hi, Alyssa. Alyssa.
I think she's working on her controls.
Okay.
It's the microphone button in the lower left, Alyssa.
Hello?
There she is.
Hi, Alyssa.
Hi. This isn't really a question about any schooling. It's more my daughter's interested in learning for this, the 6th and 7th graders. She's wondering when they're going to be able to walk through their schedules and come and decorate their lockers.
Those are 2 hugely important questions for 6th graders. I totally get it. Mr. Bear, he's here and he's going to answer this question for you, because we're still sort of working out the details, but Mr. Bear can help with that one.
Okay, thank you.
Sure. So with 6th graders, with schedules, we're still working on schedules, and schedules might not be done in time for them to be able to walk their schedules. We are going to open the building the last 2 on the Thursday and Friday of August, the last Thursday and Friday of August, for students to explore the building. They'll have their locker information. We're really not wanting students to use their lockers too much this year because of social distancing. So we really are advising against doing a lot of decorating in the lockers, etc. Just knowing where the locker is. You could use the locker in the morning. If you have a coat, especially when the weather gets colder, then for lunch and then the evening, we're really just discouraging the use of the locker just because of social distancing and grouping. But the students will have a chance to explore the building. They just will not have their schedules probably yet, which I know is unfortunate. We'll spend some time and definitely work with them the first few days of school and the first few weeks of school to make sure they know where they're going.
Okay, thank you very much.
Yep.
Thank you for the question, Alyssa.
The next question, comes from Galaxy Note 9.
Hello. My question is not so much, I guess, class-based, as if my kids go to do remote learning and you open up extracurricular activities such as sports and stuff like that, would they still be allowed to be participants or no?
Yes, absolutely. Yeah. They can join any sport team, they can join any extracurricular, so we're all set for that, no matter if they're remote or in person.
Great, thank you.
You're welcome. 2 more, Mrs. Land.
Sure, next is Daniel Wright.
Hi, this is actually Erin, Daniel's wife.
Hi, Erin.
Hi, thank you. My question is about instructional staffing. For the remote 2 hours in the morning and the in-person, will teachers be expected to manage in-person and remote, or is staffing being split so that teachers will just be dealing with the remote? Does that make sense, my question?
Yes, yep. We're going to have a remote learning team of teachers, and we're going to have an in-person team of teachers. So, yep, they're not really going to be doing both for the most part. There might be a teacher that might do mornings in person and afternoons remote, but they're not going to be full-time remote and full-time in person. There's just no way to do that.
Yep, I'm a teacher. I appreciate that. Thank you.
You're welcome. Last one, Mrs. Land.
Sure, it's Alexandria.
Hi, Alexandria.
Hi. Can you hear us?
Yes.
Oh, hi. Thank you so much for everything you guys are doing. We greatly appreciate it. This is remote learning. Last year when they did, or in the spring, when they were doing the slides and everything that the kids were learning from, they were taking notes. Well, the notes actually weren't being taken. They were slides.
Okay. Uh-oh. We lost her. All right. We'll try to get her back for the next theme. I think I heard her computer shut down. I think that was the sound of shutting down. So, okay, let's go to the next theme. The second theme for the night is really the theme that you had your top question on. It's testing and tracing. So your number one question from faculty as well as from parents was, or is, what happens when there's a positive case of COVID? And so that's on the second slide, but there's a whole bunch that happens before that positive test. So we wanted to, and you had many questions on those parts as well. So we want to sort of begin with the child at home before they even get on the bus or get in your car and enter the building. So we're going to start there. So health screens have to be done. They're going to be done at home, temperature scans at home. You're going to have the same app that you use to pick up and pick up your child. You're going to be using for the health screen. And so you'll be sending that information in every morning. Unfortunately, if you are a forgetful person like I am, I would probably forget to do that for my daughters at least once a week. So, but we're going to know that. And so we'll be able to do a spot check temperature scan before the child enters the building or as soon as they enter the building. So we can't scan all of our kids every day. It's a bit, not over, well, we could do it. It would just take an hour to do. So we're going to have you guys do as much of that as you can. So the next two questions sort of always go together. Is testing mandatory? And will schools do any testing? So both answers are no, but is testing mandatory? Right now, it's not. The CDC and the DOHs both say the same thing. We don't want you to test everybody because we don't have enough reagents. We don't have enough tests in order to make that happen. So only test the people that we need to be tested. Symptomatics, people who have been exposed. We'll talk about exposure in a second. And those that are undergoing medical procedures. And will schools do any testing? I don't ever see that happening. I don't foresee us in our nurse's office doing testing. So what happens when if the child falls ill during school? All right, so first thing, the teacher will call down to the nurse's office. Nurse does a triage, probably on the telephone. What are the symptoms? How long have they been going on? So on and so forth. And then the child would come down and they would go to the illness room, which is like an isolation room. It is supervised. There is an adult there. And then the parents are notified. At that point, most likely the parents would come by and pick up their child and bring them home. There might be exceptions where, okay, we have, the child is never going to go back home on the bus, but seeing that half of our kids are going to be transported back and forth, we may just wait the extra 5 or 10 minutes depending on how close it is to dismissal. But anyway, let's just assume that the parent takes the child home. The parent then contacts a pediatrician. And this is where that whole partnership between parent, pediatrician, and school district sort of happen, because it's the pediatrician's call and recommendation around the test. You may not be able to get in to see the pediatrician that same day, but they're going to ask you, either they'll do a telemedicine appointment, or they'll just talk to you over the phone, and they'll begin to say, listen, either no test yet or get a test done, and they'll talk to you about a timeline for return to school. But let's say that they recommend a test, and the test is positive, right? So that leads us to our next slide. So now we have a positive test, and at this point, the Department of Health takes the lead, and we follow the Department of Health. So they're the lead agency. They will set up the contact tracing, and they will notify us as soon as the positive test comes in. They will notify us, either me, Ms. Land, our nurse manager, and they'll notify us probably within 60 minutes. Basically at any time during the day or night, to tell you the truth. So, and then the contact tracers have a really important job. And they're going to be asking us, okay, what's the teacher's name? Who else is in the room? And they begin to make contact with those that the child was near. They're the ones that determine exposure. Now, we all think we might know what exposure is, but at least I thought I did. But over the last few months, Dr. Mendoza, who meets with the superintendents once a week, has drilled into us the real definition of exposure. And that real definition is there are 3 scientific pieces to exposure. It's being around a person for more than 10 minutes, less than 6 feet, that's number 2, and without a mask. So those 3 things, more than 10 minutes, less than 6 feet, without a mask. They're the ones that say, all right, just because you passed a person in a hallway, you're not exposed. If you were in the same gym class, but you were on opposite ends of the field, you're not exposed. But I don't determine that. The district doesn't determine that. We take our lead from the Department of Health and the contact tracers, because then they say, all right, these are the people that need to be isolated or quarantined. Mom or dad, you have to be quarantined because you're most likely really close to your child without a mask on at home for more than 10 minutes. So mom and dad, you're most likely, and siblings are most likely quarantined. So we work with DOH. They notify publicly. We're trying to figure out, do they do it by district name, or do they actually drill down to the building? Either way, I'd probably announce the building anyway. I would say, hey, Plank South have a positive COVID test. People have been contacted and people are quarantined. Obviously, we can't release names because of HIPAA and privacy, even though I'm sure people will be all over Facebook figuring out who the child is and who's been quarantined. So the other 2 questions that come with this one are, what's going to shut us down? Okay, that's the first question. What shuts us down? And there are 2 scenarios that shut us down. One is a regional scenario. It's when our positivity rate goes above 9%. If we go above 9% as a region, Finger Lakes region, we are all shut down. All districts are shut down. That is mandated by DOH and Governor Cuomo. So that's number 1. I have nothing to do with that one. That call is made by New York State Department of Health. The second scenario that can shut us down is something that really would fall to me and individual superintendents. And that is really lack of staff, like teachers, or lack of bus drivers. And that's due to absenteeism. So what can cause all these people to be absent? It's not just COVID, right? It's really that sense of, okay, I'm showing symptoms. I know it's a cold, but I'm coughing. I can't come in. So really what we're telling our staff is, listen, if you know you have allergies and they hit you in September, all right, you got a stuffy nose. But if you're coughing and you're just not feeling right, you cannot come in. This is a huge change for most of us. I will tell you a very brief story. My wedding anniversary is October 1st. 32 years it'll be. For 32 consecutive years, I have been sick on October 1st. I've never been well on my anniversary because it's the 4th week after school starts. And I always get sick within 4 weeks. And I always work through it. I always come to work. I know what it is. This year, I can't do that because mine always comes with a cough and I feel like crap. So I won't do that. If multiple teachers and bus drivers do that and we want them to, I may very well, I won't be calling a snow day because there are no snow days this year, but I might be calling a COVID day. And it might last more than a day. It could probably last most likely a week because we have to make sure everyone is feeling better. We can get everyone back. So those are the two scenarios, 9% or just absenteeism for teachers and bus drivers. The last question before we go to you guys for your questions, the last question for this theme is what gets us back to full-time, 100% all kids Monday through Friday? And this is where I become the least popular person in this meeting. There's only one way to get back to normal for 100%. And that is we have to eliminate the 6-foot rule. Not I have to eliminate it. It has to be eliminated for us. It has to go away. There's only 2 ways that I know of scientifically to really get rid of that 6-foot rule. One is that our infection rate goes down to near 0. Okay? And do I really see that as probable? No, not really. Not right now anyway. The other way to get rid of the 6-foot rule is we get a vaccine. And 75 to 80% of us get vaccinated. So vaccine, I'm really confident that if we get a vaccine by the holidays, the problem is it's going to take a long time, like months, for all of us to get doses of that vaccine. So the question is, do I legitimately see us? We're going to start with hybrid. Do I see us going back to full this school year? No, I don't. I see us hybrid for the rest of the year. I would love to be full person. That would mean that we're healthy and we're safe. But I'd rather underpromise and overdeliver. But the science behind this just sort of says, listen, this is a bridge year. We're gonna get through this year as a hybrid year, but a year from now, I fully expect us to be back full. There might still be some limitations, but I think we'll be back full. So anyway, that's the end of this theme. Go ahead and raise your hand if you have some questions.
Jamie Nodine has the first question.
Hi, Jamie.
Oh.
Hi, how are you?
Good. How's Josh?
He's doing well. He's
Good.
missing people, though.
I'm sure he is. I am too.
Yeah. Yeah. So my question is on what happens if a teacher goes down. We've talked about what happens if students get sick. What happens if a teacher is sick? Do we have a group of subs waiting to jump in on that, especially with the hybrid sessions? Or are we sort of like plucking anybody who can possibly teach a lesson out of somewhere and allowing them to teach? Like, how does that sort of work as far as?
I don't want to pluck. Plucking is bad. But if we have to pluck, we will pluck. So we sent a survey out to our subs. Mr. Swinson did about a month ago. And 90% of our subs said, count us in. We're ready. We're ready to go. So I think we're going to have a nice pool of subs, and which is good because we know that teachers are going to be more absent this year than in other years. Maybe not because of COVID, Jamie, but because they get other things and they're not coming in and working through their colds anymore. So we know that we're going to have, we're going to be plucking our substitutes. And then we also have teachers that are there. We have some TOSAs, teachers on special assignment. We have various people that can probably fill in for a day or so that are right on staff. That's a great question. We know we're going to use them. Definitely going to use them.
Yeah, definitely. Yeah. Thanks so much.
Thank you. Thank you.
Carm, Alexandria is back.
Alexandria, let's try it again. We're going to get Alexandria a new Chromebook. All right. So Alexandra, you just interrupt us when you get a chance and just stay on, but we're going to go to the next question.
I also sent you an email so you can reply back with
Okay.
your question as well.
Yeah.
Tessa Shermer.
Hi, Tess.
Hi, Mr. Mina. I was wondering if we chose the hybrid model and our child does get sick with just a cold or something and they need to stay home, are they
Yep.
able to hop into that remote learning while they're homesick?
So no, they won't, because that remote learning is a totally different school. And so when your child gets, if they get sick, if they get a cold, it'll be just like in normal days. All right. So they get sick, you contact the teacher contacts you back via email most likely and says, here, grab these things on demand, or here's what we worked on, here are the notes, here's whatever it is. And you sort of do it that way. And some teachers might say, hey, listen, you know what, during my lunchtime, if you got 5 minutes, I'll call you, or you can Zoom in and we can do a face-to-face review or makeup that way. Great question.
Okay, thank you.
You bet. Thank you.
Lisa Joseph.
Hi, Lisa.
Hi. Sorry. Can I go back? I really had a question about your last section, if you don't mind.
Sure.
Okay. So I think I actually just got it when you were in your last question. So the 2 days the kids are not in school, there is no synchronous learning.
Correct.
Okay, so they're not going to be expected to follow a schedule. Instead, they'll maybe have some long-term assignments that they'll
Correct. And maybe not even, correct, yes. It may not be long-term. It might just be the assignment from the previous day. Correct.
Okay. All right.
All right. Thanks, Lisa.
Andrea Peterson.
Hi, Andrea.
Hi. Thanks so much for this. I had a question from before too, and then I have a question about this.
Okay.
So I have an incoming Schrader freshman and wondered if, same thing with Schrader about lockers walking their schedule. They all want to walk their schedule. Has Schrader got anything in mind for that for freshmen?
Who is our high school principal online tonight?
Oh.
Lucky to have the Schrader principal right here. Ready, waiting to come in, coach. Hi, Mrs. Peterson. Yes, we do. We've been working out, as Mr. Bear said, similar ideas. We're sticking to the dates that we had for orientation. So we will be notifying you guys this week. They just got some rosters out to them today, to our link crew leaders. So more to come, but it will be kind of like a staged walkthrough where they're sectioned off by numbers and throughout one of the days. I think it's next Tuesday. No, not next Tuesday. Tuesday, August 25th. So we will be sending that information out either Thursday or Friday of this week.
Awesome. That's great. It's great to hear. We're excited. And then about this medical stuff, those kids who frequently get a headache, maybe it's a monthly thing, and also children with allergies. Is there a way to differentiate that on the app or, as we're filling out that questionnaire?
Yes.
Can we give them a,
yes.
can we give them a Tylenol for that headache? What's the thought on that?
Yeah, there will be, as a mom and dad, if you know that the headache is tied to her cycle or whatever it's going to be, it's like, oh yeah, you're not worried about COVID that day, right? And the same thing for the allergies. So yeah, you'll be okay for that, right? But any cough, I would say, you know what? Once we hear the cough, that's what sort of sends us into a little bit of, we get harried a little bit with the cough. Okay?
Gotcha.
This is a little bit different. So thank you. Great question.
Thanks.
Two more, Mrs. Land.
Sure. Deborah Grant is next.
Okay. Hi, Deb.
Hi, good evening. You mentioned that when it gets to 9% regionally that we would close. Is there a percentage in the schools that you would close? What would that be?
Yeah, so Deb, that's a great question. So I don't have percentages because they don't break it down for me that way. Like our regional data doesn't go by by districts. However, the other question that sort of follows from yours is, okay, but how many COVID positive tests do we have to have before we shut everything down? I don't have an answer to that because I would follow my lead because that's not my call. I would follow my lead from the DOH. And they'd say, hey, Carm, you know, you got 4 cases or 3 cases of COVID in 3 separate classrooms over at Plank South. You need to shut it down for a couple weeks. And then the question would be, okay, if we're shutting down one building, do we have to shut down the entire district? I do not have the answer to that one yet either. And that's where I would rely on Dr. Mendoza to help me out. Right now, he's saying that, you know, there might be a chance that it's building by building. But he would help us through that process. That's a great question, though.
Okay, thank you. One other one.
Sure.
With the contact tracing, you mentioned that they'll go through the classroom and the teachers, and does that get extended to transportation, the buses that they come into?
Yeah, yep. So again, that's where the science of exposure really helps us because they probably would reach out to the bus driver perhaps, but they're like, listen, this child was 8 feet away from you. You had your mask on, the child had his mask on. You're probably not exposed, so you don't have to go into quarantine. But the contact tracing may go that far. It may extend out that far. But that's really it's up to the discretion of DOH for that one.
Okay, well, thank you.
You're welcome. Last question, Aaron, I think, right?
Do you think the third time's the charm for Alexandria?
Sure.
I don't think we got her.
I don't think we got her. Okay.
All right. Christine Hodgson has the last question.
Hi, Christine.
Hi, thank you. Actually, this is Ashley Youngman on my neighbor's.
Hi, Ashley. Hi.
And I had to say that because I kept clapping and applauding because I couldn't find where to raise my hand. But we just need some clarification on the slide you were talking about testing, screening, contact tracing slide. Specifically on what does a person falls ill mean to you? And because I just was a little concerned after you said something to the effect of, you know, if they fall ill and it's close to dismissal, they'll go on the bus. So for me, that's concerning unless you know, what's your definition of falls ill?
No, and actually, Deb, I didn't mean it that way. We would never put them on the bus. What I meant was you know, if it's 5 or 10 minutes before dismissal, we probably wouldn't say to mom and dad, get right here, right now.
Oh, okay.
And grab your child. It would be like, you know what, we're going through dismissal right now. Let's keep the child isolated and then come by like 20 minutes later. That's what I meant.
Okay, that makes much more sense. Okay, thank you. And then a follow-up to that is if we're you know, many children in one home and one child falls ill in the morning or has a fever in the morning or doesn't pass that test, does that mean all of our children are staying home that day?
No, not from the guidance that I'm getting from Dr. Mendoza. It is, you know, it's very specific to that particular child. So symptomatic children should stay home.
Okay.
It may not be COVID, and most likely it's not. I mean, with our infection rate right now below 1%, you know, it most likely is not. So, but just, I mean, it's up to mom and dad too. If they're like, you know what, we're not really sure. We're going to keep everybody home.
Oh, for sure. Okay. Thank you.
Does that make sense, Deb? You bet.
Yeah.
Thank you. All right, let's move to our last theme, which is cleaning, distancing, and masking with a little bit of ventilation at the end. So we are going to look at this from 3 different perspectives. We're going to look at this from the bus. So Deb, you're going to love this. We're going to look at this from the elementary classroom, and we're going to look at this from the high school classroom, or I'm sorry, the secondary classroom. So on the bus, right now I know the top bullet says 50% reduced capacity. Most likely that's going to be 25 to 30% reduced capacity, because think about the math with this. We're only half of our kids are coming to school at any one time anyway. And then of those half of them are being driven by mom and dad, according to the survey. So this is great news for us because we'll have so few kids on the bus that we'll be able to give them their individual seat, and siblings can sit together, but their individual seat, and we can keep them spaced out. And they'll be masked on the bus, and we'll be able to hit those high contact areas in between bus runs, intense cleaning at the end of the day, You can send your child on the school bus with their own sanitizer. The district sanitizer that we get from the state, we can't put that on the bus. It's not allowed for a variety of reasons. And then some of our questions that we got were, can we do plexiglass? And we can't do plexiglass anywhere. Buses, campus, doesn't matter because it's flammable. So we can't use that. And obviously anything that obstructs the driver's view or obstructs the driver at all, we can't allow either. So that's the bus. Now, elementary classroom, what's that gonna look like? So we expect a range of about 8 to 13 kids per class for the hybrid learning. Remember, they're only in school for 2 hours. So I fully expect the mask to be on at all times. There can be a few exceptions. If you think about this from a teacher's point of view, let's say they go outside and they space out by 10, 12 feet and they read a book for like 10 minutes. At that point, the teacher might say, you can take your mask off, but you can't move, okay? Because you got to maintain the 6 feet. The high contact areas throughout the building are hit several times a day. The rooms themselves at the elementary level are cleaned between the AM and the PM session. And every staff member is going to have the opportunity to be trained in cleaning, including myself, including Mrs. Land, including Mr. Neenan. And we will be cleaning. I will be going to an elementary school in between sessions, and I will be cleaning classrooms. And the solutions that we're using, first of all, I love to clean. I love the smell of clean. If I could use bleach, I would use bleach all the time, but we don't use that in our buildings. We use something that is hydrogen peroxide based, and it's very, very safe. And Mr. Cunningham is about to tell you all about that. And then obviously at the end of the day, when all kids are gone, we do the normal thorough cleaning of the entire building. So let's talk a little bit about the cleaning solution that's used at the elementary level and also at the secondary level. So Mr. Cunningham.
Thanks, Carm. To let everyone know, pre-pandemic, we used a product in our bloodborne pathogens program from Diversity. It's called Oxivir TB. We were lucky enough when the CDC first came out with the COVID list of approved chemicals to kill the COVID-19. This one was listed on it, and the good news also is that it has a 1-minute contact kill claim against the virus. Part of the selection of this also is the MSDS sheet. This has an HMIS rating. The HMIS rating basically looks at safety, fire, and combustibility, and they're all listed and rated at 0. 0 being the best and 4 being at the worst. So as a product, the district is very comfortable with not only the safety of the product, but the kill claim.
Great, thank you, Blaine. So that's the elementary. The secondary classroom, 8 to 13 kids. There are a couple instructional spaces at, especially at the high school, that are really, really large, and we may end up having 15 kids in those. But again, everything's about the 6-foot rule. So, we look at square footage, and we just look to say, okay, we can have this many kids in the room. But the vast majority of classes are going to be between that 8 to 13 range. Again, masks are on at all times. I put discretion of teacher because it's very similar to the scenario that I gave you for elementary. If you're in a huge space and you only have 5 kids and the kids are spread out hither and yon, maybe there's a 2-minute break. Or if you're in PE class and you are outside and again, you're spread out, again, there might be a mask break. High contact areas hit throughout the day. Desktops wipe down in between classes, same solution. Again, it's all hands on deck as well. And then obviously when the kids leave, we do a thorough cleaning. So let's talk about lockers and hallways. So at the high school, the majority of our kids don't even use their lockers. But at the middle school, they all do, and they use them frequently. But this year, as Mr. Bear said a few minutes ago, we are going to ask all of our students to only use their lockers 3 times during a day, at the beginning, at the end, and before lunch. So again, that's going to be a change for the middle schoolers, and we know that, and so we're going to allow the full-size backpacks this year, knowing that they're not going to be able to get to their lockers. Walking in the hallways. So our kids are going to be switching classes, and we know that this is going to be the toughest part. We're going to put signage down. We're going to tell them, here's 6 feet. You're going to walk on the right-hand side. But any of you who know middle school boys know that they're not 6 feet apart. They want to be 6 inches apart. So we're going to be constantly reminding them to, again, keep their distance. Again, this is where the science of exposure helps us. Remember, exposure is less than 6 feet for more than 10 minutes without a mask. So while they're passing in the hallway, they're definitely not passing for more than 10 minutes. They're only passing for 4 or 5. They have their masks on, but the 6-foot piece, we know that might fall short. So this is the piece that we're just going to constantly be reminding and hounding and nagging our students on. So that is the secondary classroom. I want to end the theme with our last slide for the evening with ventilation. Mr. Cunningham is going to take over in a minute, but the wonderful thing about school buildings is that their HVAC systems are built for airflow and they're not built for comfort. So it's all about how quickly can you refresh the air in a contained space with outside air, outside fresh air. So we have a refresh rate of between 4 and 12 times per hour. So basically, if you think about every 8 minutes, a certain space is refreshed with outside air. And that really helps us. And it really helps us with, again, with decreasing that, the level of exposure, I guess, right? Because the more ventilated you are, the better you are. So Blaine, can you talk a little bit more about this?
Sure, Carm. You may recall that Governor Cuomo stated that he wanted malls to open with a MERV rating of 15. That rating is in regards to the thickness of the media of the filter. As a school district, we cannot go MERV 15 simply because our systems are different. Our systems consistently and constantly run, unlike home and other commercial buildings. A lot of times when the thermostat is satisfied, it'll shut off because the temperature is where it needs to be. Where our fans run continuously in order so we can obtain those turnover rates that Carm spoke about. Part of our Tools for Schools program several years ago, we are dealing with a company, a Penfield FAR filter, and like I said, it is a MERV 8, and that allows us to continuously maintain those air turnover rates that are mandated by SED. Remember that our systems also bring in so much outside air because it's a damper system. And these dampers are similar to windows and they modulate as the room needs either cooled down or refreshed. The second part of this is that the district for the past several capital management or capital project improvement plans, we really invested in our energy management system. This system allows us to monitor all our HVAC systems, making sure that the components are working properly. We were able to change things, set points, dampers. We're able to control things if there is a concern and increase that ventilation if needed. And probably the best thing about that system right now is that if it was to fail, it sends alarms out to our HVAC specialists via laptop, smartphone, and desktop computers so that we can react accordingly in a prompt fashion.
Thank you, Blaine. All right, so that's our last slide for this theme. So go ahead and raise your hand and ask any questions that you need to ask.
Our first question comes from Lindsay Short.
Hi, Lindsay.
Hi, my question is, are there going to be any specifications on what type of masks the kids are allowed or should be wearing? Like, I know they're not recommending the kinds with vents.
Yeah, we would probably follow the guidelines from CDC and DOH. So the cloth masks, the homemade cloth masks are okay. I don't even have one over. You know, the blue ones, the blue surgical ones that that we tend to have. Actually, they're not surgical, are they? But
the N95s. Yep.
yeah, thank you. Yep. The one piece that came out today, and I'm not sure if it'll get to the CDC just yet, but those the neck gaiters are not. They're not going to be recommending those. The neck.
I was wondering about those specifically.
Yeah. Yep. So, but we'll be able to let people know which ones are good.
Thank you.
Thanks.
Tim put his hand down. How about Karina?
Hi, Karina.
Yes, this is David, her husband. I had a couple of questions about masks, and how would you maintain 100% compliance of wearing masks with young children? And what if a child loses or forgets their masks on any given day?
So let me take the second
backup plan.
The backup plan is we're going to have masks for kids. So if a child forgets one or loses one or sneezes all over one and they need a new one, we'll have our supply. In terms of compliance, we deal with compliance every day, especially with younger kids. Actually, it doesn't really matter how old the kids are. That's really part of being a teacher. So the teacher would be able to work with those children and say, listen, in Webster, because we care and part of our care model, this is what we do. In order to keep each other safe, we wear our mask.
I had a question about learning methods. You mentioned two terms, asynchronous learning and on-demand learning. Are they the same?
They're the same. Yep.
Okay, thank you.
Yep. You bet. Thank you.
The next question comes from A Micro.
Hi, I just want clarification on the teacher's discretion of wearing masks or not. I'm assuming that means as long as they are distanced from
yes,
that it's at their discretion.
Yes, absolutely, right. So those scenarios I was giving you, if they're outside, they're reading a book and they're all apart, there's a chance there. Or if the teacher says, go ahead, take your mask down for a minute or so. But yeah, there's no mask breaks if the kids are close together. That's not going to happen.
Okay, thank you.
You bet.
Gina Colombo.
Hi, Gina.
Yeah. Hi. I just have a quick question. The elementary, I have a first grader coming into at State Road. Will they be able to go in and see their teachers beforehand?
No.
No.
I don't think that's going to be able to happen. Sorry.
Okay. No, that's okay. I just have one other quick question.
Sure.
They're going to be bringing their iPads to and from school. What happens if they forget it or lose it or some strange thing?
So I don't know about your kids, Gina, but my kids would never forget something at home or lose it, destroy it, damage it.
So you have better kids than I.
No, actually I don't. So that is all part of, our plan in terms of, we know that kids are going to forget things. We'll try to have a couple extra maybe, and we also know that kids lose things as well. So that's part of the replacement plan that we have and that all you guys are part of. So, we're ready for that when that happens.
Okay.
Hey, Carm, can I just jump in on that one?
Sure. Thanks, Brian.
No problem. So each classroom is going to have 2 iPads or Chromebooks additional in case that happens. We don't want to stop the learning for that day. If stuff gets broken, whether it's accidental or malicious, we'll work with the families, figure out what the best plan is, and we'll make sure that the kid always has a device because we want to make sure that they're not falling behind if something like that occurs. So we've been doing the one-to-one program for middle school for 5 years now, and we've had a really good time with it. So we're just going to extend some of those practices down to the K through 5th grade students as well, and we'll make it work. We'll work with you guys and do whatever we can to support the family and the students.
Okay, thank you.
Thanks, BZ.
Next question is from Mrs. McCoy.
Hi, Mrs. McCoy.
Hi. I just have a question because
kind of goes back to the learning, and just we know this is going to be a challenging year with inconsistencies, and I'm wondering, standards wise for students, has there been any discussion about shifting standards? I find it's going to be really challenging for teachers, no matter how hard they work and how hard the students work, to get through a whole year's worth of curriculum. And what's the kind of the plan? Or is there discussions being?
Absolutely. And we'll be working, Mrs. Land and Miss Armstrong will be working with the elementary principals as well as all the lead teachers, and the teachers will be working within their teams, because you are absolutely right. This is not a typical year. There's no way we're going to be able to get through. I don't care if you're taking Regents Chem, AP Bio, or third grade social studies, or third grade ELA. I have to make those curricular decisions about, okay, what are the non-negotiables? What are those super standards? And those discussions are definitely happening.
Okay.
Good question. Thank you.
Thank you.
Next question is from Natalie Yeager and Tal.
Hi, I have two questions. One was, is there any information about the UPK program at Doodlebugs?
Let's see. I know that we're still trying to work with Doodlebugs, because we're not quite sure if we're not.
Mr. Freeman.
Yeah,
he has
Mr.
that
Freeman.
answer.
Okay,
So,
sorry.
Yes, the UPK at Doodlebugs will continue as planned.
Oh, good.
That is hot off the press from
It is
3
hot off
o'clock.
the press.
3
Okay.
o'clock this afternoon.
That's wonderful. Terrific.
Good question, because I didn't know that one. Awesome.
Fantastic. Okay, my other quick question is, in terms of students with an IEP, is there a time estimate as to when those schedules will come out? I'm sure it's by a building basis, but it would just be helpful for planning.
Sure. Mrs. Armstrong?
Are you talking about service schedules or their classes?
The service, the extra
Yeah.
services.
That probably won't be till, close to, if not right at the beginning of the school year, because we've got a lot of things that we have to work out between who's in person and who's not, to make sure that everybody gets all the service that they need.
Okay, but it will be what is on his IEP in terms of the time?
Yep.
Yes.
Okay.
Yep.
Great.
So for example, if he had speech twice a week, he's going to get speech twice a week.
Great. Thank you very much.
You're welcome.
Last
Next.
one, Mrs. Land, I think.
Sure. Yeah, sure. It's Alyssa Johnson.
Alyssa.
Hi, I'm in my parent seat. I have a question regarding transportation. We were thinking through childcare options, and I'm sure there's other parents that might be in the same situation, where traditionally there might be several days of the week where we're in a pinch and we make plans for childcare at a friend's house or a pre-designated babysitter that is in the same building. Are kids going to be able to have bus passes for childcare purposes? Just thinking about the social distancing on the bus and planning for that.
It's a great question. Mr. Freeman.
Hey, Alyssa, why don't you come around the corner and ask me when I get home?
Okay, make a plan.
Yeah, it's a great question, though.
Yeah, it's a little overly complicated when we're trying to stack the buses for social distancing. If then all of a sudden we have 2-3 kids pop up that would overflow that bus for social distancing purposes. If if you got one day here, one day there, so.
Okay, all right, okay. So if it's something that's a set schedule, that would be something that may.
Correct. If it's something that is built in, and then we could route and put the numbers on that bus that are consistent, then we're good to go. But if it's, a last minute, it's probably one we're not going to be able to entertain.
Okay. All right. That's helpful information. Thank you.
Okay. Thanks, Alyssa. Okay. So we're going to end there. Don't worry if you didn't get your questions answered. You can either email me directly, fill out the feedback form, and we'll try to get you an answer. So before we say goodnight, I want to say thank you for a few things. One, for spending 75 minutes on a Tuesday evening in the summertime with us. We are incredibly grateful for your support, your patience, your flexibility, and your advocacy for your children, as well as for our community. It's very heartening for me to be able to see close to, well, we had over 1,000 parents over the last 3 evenings. And I know you guys are all in 2x2 squares right now, but it's very nice to see all the support. And again, people who understand that we're sort of in this together. So thank you again for all that you're doing, for all that you will do. And hopefully we get to see your kids either virtually or let's see, in 4.5 weeks, I think. So I'm sure you guys can't wait either, perhaps to get rid of your children, even if it's only for 2 hours a day or 2 days a week. So, but thank you all very much and have a great evening. Good night.